Hello and welcome to today's episode of Health University, where we talk all things about the health of you, Y-O-U, and in particular the health of your reproductive wellness and fertility. And today I have the good fortune of introducing to you Lisa Monka. Lisa is a licensed professional clinical counselor and a board certified dance therapist who helps people reconnect to their bodies so that they can release pain and feel good again. Dance therapy, as Lisa explains it, allows us to explore our emotions using movement and access thoughts and feelings that might otherwise stay hidden. And by connecting with our bodies, we can express and feel emotions, let them flow through us, and release tension, pain, and stress that we carry. So, Lisa, welcome. Is there anything in that bio that I missed that you would like to ad lib?
No, Susan, I think you did a really good job of covering all the things, and we can definitely get into more detail, but that's a very good overview.
Thank you. Thank you. I'm really curious about dance therapy. So tell me, first of all, how did you get into dance therapy?
Yeah, that's a really good story,
Yeah.
actually. So this was way back when where you just had Google and you could like type into Google and find out about things, right? No chat GPT. We used to have
Mhm.
Google, right? So I was like, there's art therapy in the world, there's music therapy, there must be dance therapy. So I typed dance therapy into Google and I found the American Dance Therapy Association.
Uh-huh.
And then I found their list of programs that were approved programs, grad school programs. And I decided that I was going to apply, even though I didn't quite know what dance therapy was.
Yeah.
So that's kind of how I found it. And luckily, it just combined two of my loves, which is dance and psychology. And
Mm.
I've been doing that ever since.
Okay. Well, then tell me if as best you can, what is dance therapy?
Right. So the American Dance Therapy Association defines it as the psychosocial use of movement. So we're looking at movement, not just like, does this look pretty, but what does it say about my mental health? What do my movement patterns say about how I cope with the world? Like how you move is very indicative of how you're feeling, right? If you've ever seen, I'm sure you've seen this, Susan, somebody walks in and you're like, oh, they're having a bad day and they haven't even opened their mouth, right?
Mhm.
Or even recognizing a friend, say you forget your glasses and you can recognize your friend's walk from like that far away. Like there's these things. Movement is really distinctive and shows a lot about how we're feeling. So it's not also there's a combination, right? It goes both ways. Not only does it show how we're feeling, but changing our movement can change how we feel. So that's basically dance therapy in a nutshell.
That is amazing. I love that. Changing our movement can change how we feel. So it sounds as though this could be, probably is an intentional process by which what you help take someone from feeling in a way that they would rather not, grief-stricken, angry, overwhelmed, depressed, into an expression that they'd like to find themselves in, sort of at peace, at ease, comfortable in their body. Does that make sense? Did I
Yeah,
describe that well?
absolutely. I think the first step for a lot of people can just be connecting with the body, right? So, how many
Mhm.
of us don't notice that we're starving until the end of the day, or we don't notice how we're feeling until it's like a big eruption of emotion or a
Mhm.
really strong signal? So, if we can connect with our bodies again, yes, sometimes we have to feel the grief and the pain
Yeah.
in order to let it go,
Mhm.
but then we also open up this whole world of feeling joy and happiness and, lightness that maybe we weren't allowing ourselves to feel. Like you can't just numb one emotion, right?
Yeah.
You can't decide I'm not going to feel sad ever and not affect the other emotions,
Yeah. Right, of
joy.
course, because
Yeah.
it's all energy, right? I mean, I live in the world of qi, energy, and Chinese medicine, and we end all of the emotions. There aren't bad and good emotions. There are ones that we prefer to feel and ones we prefer not to feel.
Yeah.
But they do all have to move through us since we are the vehicle. And so if someone were, in this case, our listening audience, were struggling with a fertility challenge and found herself to be pissed off every time she sees a pregnant lady walk past her, and there seems to be, every second or third one seems to be pregnant. How would you help her kind of identify her feelings and what she might do to move through them? Is that something you can actually describe in a conversation like this?
I will do my best,
Good.
right?
Okay.
Each person is individual. So we'll go with the hypothetical though, right?
Yes.
Um, Well, first, I think I would just want to acknowledge that for women, being angry is often a difficult and challenging emotion, and one we're taught nice ladies, women, girls don't feel. So I think I would just want to hold space for that. You
Mm,
know, you can be as angry as you want in here.
mm,
You know, can we find movements that help you feel the anger and let it go? Like, you know, we might just physically punch until we're tired. Okay, I'm
mhm,
tired of being angry. You know, that might be
mhm.
an option. I'd have to see what works with that person. Other people express anger differently. But anger is just showing us that, you know, a boundary has been violated or we're upset about something,
Yeah.
and it's not, it doesn't have to be a permanent state,
Yeah,
right?
yeah. I
So
almost view it, Chinese medicine views it as a suppressed or pent up emotion that wants to be expressed so that we can again move into our creative expression, that
mhm.
that a more joyful creative expression. So I can envision in this conversation with you that that person, that hypothetical person, might do well to just really shake it off, sort of like
Mhm.
stomp, scream, wave her arms or something like that as a way to move that energy. Does that sound somewhat similar
It
to what you might?
does.
Mhm.
And based on what I see, so a great part of my dance therapy training was just analyzing movement, right? So based on what I see in that person's movement, I can make a movement intervention. Like I could suggest movement interventions, and that's why I can't say, oh well, for this I would do this. It'd be like, well, no, I have to see, because what if this person has this quiet internal anger? Like,
Uh-huh.
what do I do with that then? You know, or what if this person is all rageful and explosive? Then how do we bring that in? So we
Mhm.
have different ways of expressing anger, and each person is
Mhm.
different. But
Mhm.
I think, to your point, right, underneath that anger, that stuck emotion, right? We often talk about anger as a secondary emotion. Like there's probably sadness or
Mhm.
grief or loss for
Mhm.
somebody that's going through fertility struggles.
Mhm.
I'm guessing, you know, but
Oh, yes. I don't
um,
think anybody goes through fertility struggle saying, "Wow, this is cool. Give me more of this."
right. And
Yeah.
there's like this, a lot of times in our lives, there's this imaginary version of what our life is going to look like. And then there's actually what our life is going to look like. And we spend all our time over here with the imaginary version and being so upset that it doesn't look how we thought. I think
Mhm.
we end up with a lot of pain and suffering for
Mhm.
sure.
Mhm. And I want to pivot just a teeny bit about the word dance. When I think of the word dance, I think of, something choreographed or something beautiful to look at. Do you hold the word, do you have a different definition of dance as it applies to dance therapy?
Right. Well, we're not doing like a choreographed like ballet or jazz or tap or
Right.
anything like that. It's more that if you're moving, like that movement piece, if you're breathing, you're moving, right? So anyone can do dance movement therapy. I think the dance piece comes in with the idea of rhythm. Like rhythm can be such an organizer. If we think back to the people that were starting with dance therapy, a lot of it was like helping folks with major mental illness like schizophrenia, schizoaffective disorder,
Mm.
bipolar, like helping them contain. And rhythm is a great container, right?
Mhm.
So we have that in movement, and we also have, and that I think the music, right, that helps. Anytime we're moving to music, it gets called dance. And then the other piece I think is the training, right? You need to have some kind of dance training because part of what we do is mirror in our bodies what somebody else is doing. It's not an exact copycat or mimicry, but it's more of like if I get the idea of how someone moves and how that feels in my body, it informs what this other person might be going through. So it's
Mhm.
like a kinesthetic empathy in a on a bodily level. Does that make
Mhm.
sense?
It does. It does. And so I can imagine if I were to have a session with you
Mhm.
and you would be sort of, observing how I move or how I don't move, and then making some suggestions or, or impressions on what I could do with my movement to get out of this little pattern. And
Yeah,
then can I take that and do it on my own? Is there homework per se, or is this something that is sort
sure.
of a one and done?
I wouldn't say it's a one and done. Therapy is hard to have as a one and done.
I
I
know.
would have to say.
That
Um,
was a setup.
yeah. Well, I think one of the things we would definitely cover is, you know, I'm going to be moving with you. So it's not as uncomfortable as me just watching you move,
Mhm.
right? And it's also like there's not a set group of movements, but I might be making suggestions like, well, when you're moving this part, what feelings, emotions, sensations come up? Are there images? I'm helping you kind of guide, and then you'll be surprised at what pours out. Oh, I'm moving my shoulders, and when my shoulders are tense, it just reminds me of whatever memory or whatever thing went on in the day, and that's our kind of access point. Um, I think sometimes I will have clients, I'll say, hey, we worked on this. And, when you move around, you notice that you're always staring at your feet. I want you to just, it's not all the time, but can you see what happens in your body when you look up? And say we do that work in session, I might suggest that they try that throughout the week and see how their week went and
Got
how
it.
it felt. So that might be the homework,
Yeah.
you
Yeah.
know, extrapolating on what we can uncover in a session.
Hmm. And then would it be would it seem that each session is going to have sort of a progressive or new or different movement, or is it such that there is a pattern of holding or movement or lack thereof that has you progress with sort of a similar dance therapy, I don't even know what to call it, exercise.
Sure. I think it really depends on the person. So the way I work is I have people come in and I have them tell me, at the very, very start, what are your goals? What are we working on? And we'll come up with like together we come up with shared goals. Okay, I really want to work on, that lady would be like finding ways to cope with my anger, especially about this
Hmm.
situation.
Hmm.
Um, and then I think based on what I see when we do a movement warm up, and also I do a check in at the beginning, ask people how their week went, what's top of mind, and between those two things, I decide what to work on. So we could be working on our long term goal of like helping her cope with anger, but say something else comes up and there's like grief. I'm not going to say no. We're only going to work on this particular way of moving or coping. I'm going to open it up to what's there. It's kind of like you put out the fire that's in front of you, right?
Right, right, right. And I can only imagine that the fire that's in front of you has some relationship to the end goal or the sort of ulterior issue at play.
Well, our body's all connected, right? If we loosen
Mhm.
up something up here, that has an effect on everywhere else. If we loosen
Mhm.
up, if we get something in the chest, that's going to affect everything else. So I kind of I do think of it as, all integrated.
Yeah, yeah. Now, are you able to do this like online, or is this only an in-person kind of event? And are there, classes that someone could take, or is it really just a one-on-one because we are all unique?
So I've done dance therapy groups. Right now I do dance therapy workshops, which is lovely. I will do that more in like a school setting or like a wellness setting for like a
Mhm.
business. But usually it's right now I'm offering one-on-one sessions and it can be either in person if you're in San Francisco
Mhm.
or it could be online. And online works as well. The only challenge for me is trying to see the whole body, right?
Right.
So I'll be like, keep scooting back so I can make sure.
Yeah.
And then sometimes the music can be a little bit of a challenge, but I'd rather have people put on music on their end. It's less
Mhm.
important for me to hear the music as it is to see the whole body and how
Mhm.
that's moving.
Mhm. Hey, thanks for spending your time with us here at Health University. I hope you're getting as much out of this episode as we are. And I wanted to call to your attention that there seems to be a theme that we need to detox. It is part of a foundation of resuming health, including your fertile health. So I've put together a free 28-day detox masterclass that you can access by clicking on the link below. I'm sure you'll get so much out of it. And as I say, I think that it is really critical to begin with a 28-day gentle detox. And now let's go back to our show. Do you have any sort of particular stories in mind, like thinking of someone possibly struggling with fertility or something along those lines, where you could say, this is how she came to me, and this is what we did, and this was the outcome?
Sure. Yeah, I'm trying to think of how to, preserve
Oh,
confidentiality. But I have,
of course.
yeah, I have
It
had,
could be even a weave of people rather than.
yeah, yeah. No, I think I have had a number of women who have experienced sexual assault or
Mm,
trauma, and then we've had to work through those complex emotions. And I'm sure even with fertility, right, those kind of things are going to come up as
yeah.
well, right? Any kind of, you know, we're talking about reproductive organs and anything, any kind of trauma that happens to that. So I've been able to work through that, and a lot of times it'll be like a strange pain or something that sticks, and it's like, well, I massage it, I do this, I do that, and sometimes it's like, what what can we do to move? What does that body part want to say? And
Mm,
I've been able to discover a lot through
mm.
that, like through that moving through.
Ah, so you're talking to the person as I'll use the pronoun she, since we're
Sure.
talking,
Yeah.
most of the listeners are identify as women, as female. So you're talking through it as she's moving, or she's talking through it as she's moving.
Yeah, both.
Okay.
So it can be it's interesting because it could be someone could be so lost in the movement that I'll give little suggestions
Hmm.
and interventions, but not they might not be ready to talk yet. And then we
Hmm.
could wait till the end of the session, and I might be like, hey, I saw this movement phrase, or it felt like when you moved your hips, you became tearful. Can you tell me a little bit about that? And
Mm.
we could process it in that way. Or I could, in the moment, if the person feels open, and this is often a clinical judgment, if I interrupt this person right now, are they going to lose the whole flow? Right? But
Right.
if the person feels open, I could be like, hey, I see something going on in your face. What's happening right now?
Hmm.
What's happening
Beautiful.
for
Yeah.
you? Right?
And
So go either or. Yeah.
yeah, I wonder then, therefore, since you are combining modalities and don't want to interrupt a flow or an expression, do you find that there is a longer timeline for dance therapy as opposed to talk therapy? Are you doing 80 minutes versus 50 minutes, for instance?
Usually the sessions are 45 minutes, but
Hmm.
I think that sometimes it's like it takes a longer number of sessions for
I
people to,
see.
one, feel comfortable,
Yeah.
and two, to feel less defended and be able to do the work.
Hmm.
And that's not to say that you're not getting results with dance therapy. It's more the idea of um, we use movement all the time, but using movement as a language to express ourselves in a psychological way
Hmm.
might not be something we have access to. So I give the example of, say you learned French and you learned business French, right? Like you were just trying to interact with someone and you're talking about deals and negotiations and etc., right? And then you fall in love with somebody from Belgium. And
Hmm.
then you have to learn this whole other language. It's still the same language, right? It's still French, but
Hmm.
it's the language of love. So we're going to like talk different. We're going to do things different.
Yeah.
And it's just the same idea with movement, right? We move every day in a practical way, or maybe we move for exercise, but using it for our psychological health, it just might take a little bit of time.
Hmm. Exercise. I like that you pinned that. Um, do you find that there are forms of exercise that are helpful or will hinder someone's ability to use dance therapy as part of their modality? I'm thinking if someone's going and, just only doing high intensity interval training, are they more likely or less likely to be able to relax in their body to do dance therapy?
Oh, that's a good question. Again, I think it comes down to if you're breathing, you could do dance therapy. My friend did dance therapy with people in hospice.
Mm,
Will their level of comfort, if they're used to high intensity exercise, and I say, hey, can we slow down? But this is part of the work, right? We're expanding their movement repertoire because you can't be high intensity all the time. That's not going to be good for you.
right.
But there might be some discomfort around it, right?
Mhm.
A good example would be I worked in a men's prison, and it was a psychiatric hospital on a men's prison ground. And all of these movements that the men were doing, there was a lot of contraction, a lot of like muscle,
Mhm.
weights,
Mhm.
yes,
Mhm.
because that's what they needed to do to survive and to
That
have
makes
that
sense.
kind of exterior and literally that guarding in their body,
Mhm.
right?
Mhm.
So getting them to work with softness or play or that kind of
Mhm.
thing,
Mhm.
that is still part of a healthy repertoire.
Mhm.
And even though they were used to more, contracting and lifting heavy weights, it was available to them, right?
Uh-huh.
That
And I'm curious, what was the experience like? Were they
Um,
kind of awkward with it? Were they
You know,
embracing
they
of it?
were great. They were some of the most creative and intelligent people that I've worked
Mm.
with. And if you can imagine, like, because it was a maximum security prison, these guys would be like, "Oh, I haven't seen a beach ball in 20 years," and I bring a beach ball out, and that like
Ah,
sense of
oh,
lightness, right? So dance therapy does use props.
oh.
So I think for me, it was a wonderful experience in figuring out, oh, this does work. And also, it's directly correlating with how much people trust you, right? If they don't trust you, or if they think you're insincere, or that you're kind of being sketchy, or or you don't have their wellness at and their well-being at heart, um, people aren't gonna want to move with you. But if you create a nurturing environment and a place where they feel safe, people
Mhm.
will move.
Yeah. What other kind of props do you use?
Oh, that's super interesting. So we use like a parachute, which is super fun. Like,
Kind of like I think of like when children are.
yes, but think about what a parachute, like that kind of shaking.
Hmm.
If you're angry or having that, like, huh, like this is a very good motion. Like you can put a lot of strength into it without hurting anyone, right?
Hmm. Hmm.
We use like stretch bands, which is great because in groups there's a lot of connectedness, right? So getting everyone to take a piece of the stretch band, which is circular, and then you're feeling connected to the group. We use
Ah.
balloons, sometimes balls, yeah, like a yoga ball or things like that. And it can just be about connection. Oh, scarves. Classic dance therapy prop is scarves, which is
I was
again,
thinking scarves and boas.
yeah, but if you think about scarves, there's a lightness if you're moving with a scarf, right?
Hmm.
So say someone who's super depressed has that like concave chest, and
Hmm.
then we're trying to elicit lightness. What kind of props would you use? Like a
Hmm.
balloon or a scarf? Or
Hmm.
we're trying to expand the movement repertoire beyond what their normal is,
Hmm.
and
And oh, go
it
ahead.
happens over time.
Yeah, I think that was part of my question. Kind of in general, if that's even appropriate, a question, how many sessions might it take for someone to begin to feel like, oh, I got this. I can do this movement therapy, this dance therapy, and it doesn't mean
Sure.
they're done, but at least they're in it, and maybe they're done. Maybe they.
Yeah, I ask people to commit to like 10 to 12 sessions. Try one
Okay.
out, see if it's for you, because if somebody comes in, they're like, there's no way this is happening for me, then that doesn't make sense. But I ask people to commit to from 10 to 12 sessions.
Mhm.
And that gives us a time to really do some work and you can really be digging into that. So that's probably the time frame I would
And
say.
is it once a week or
Yeah, once a
okay?
week.
Hmm.
And then again, some people, if they have a background in dance, they might feel a lot more comfortable a lot earlier. But some other people, it might be like, I just have to connect with my body, and that might take, 2 months. Who knows,
Hmm.
right? And we want to make sure to give it a fair chance.
Yeah, got it. Well, that's so interesting that the 12 weeks, again, the people who are listening here with an ear, an eye, and heart toward fertility,
Yeah.
that's the time frame within which a full cycle of follicular growth to ovulation occurs as well as that 120 days. So I can just imagine that there's a lot of life being lived in that 12 weeks in that 120 days that will then each week allow for something more to evoke from that person, especially if it's a person who's going through the hormonal fluctuations of a cycle.
Yeah, I
Yeah.
think that's beautifully timed then. There's like, it seems like it would work out very well for some people.
Yeah, yeah. So listeners, if as this might be your or someone you love have this is their journey right now is going through the arc of fertility from primordial pool to ovulation, that 12-week time frame, might be a modality you want to consider including if you're feeling, well, I mean, I was going to say if you're feeling stuck in your body, but I think I heard you say sometimes people don't even know they're stuck in their body. So
Right.
is
If
there
you're
an
feeling disconnected or
yeah.
just stuck in general,
Yeah. Yeah, yeah, yeah. Is
Yeah.
there an assessment that listeners or viewers could, kind of go check out? Is there, do you have like a quiz or is there a YouTube channel or something like that where they can, check it out and see, oh, that's what this is about?
I have photos on my website. And, maybe adding a quiz or something would be helpful. I think I would say go to my website and look at the language and see if
Hmm.
it speaks to you, because I've really worked hard on trying to encompass that working in the body.
Hmm.
Um,
And
and
recite your website. It'll be in the show notes, but so the
sure,
people.
it's Lisa Monka, and my last name is spelled M as in Mary, A, N as in Nancy, C as in Charlie, A,
Uh-huh.
.com. So lisamonka.com. And
Perfect.
I've also written a bunch of blogs too, so that might give you the best idea about
Hmm.
that. But there's going to be, in every session, there's going to be a beginning where we kind of connect, a middle where we work in the body of the session and what the heart of our issue for today that we're working on, and then an end where we do a bit of closure and kind of examine what we do. So that's definitely in there. And also, I do a free 15-minute phone
Oh,
consultation if you
lovely.
need more of a, any kind of questions you have, or if you're like, I'm halfway in, but I want to know a little bit more about it, please
Yeah.
feel free to schedule a consult with me.
And they can get that at your website as well, a link through to the
That says book your free consultation.
Perfect. Perfect. Well, I want to be respectful of your time and the viewers' time, the listening audience's time, and I want to make sure that I didn't miss any opportunity for you to impart, a pearl or something really particularly special that you want to make sure that you get across. So I'm going to leave the floor to you for the next couple of minutes to share
Yeah.
your thoughts.
Um, so I think one thing we should think about is just like, as women, we have such a connection to the earth, to our bodies, to, trying to grow another human being, which these women that you help are trying to do,
Mhm.
and hopefully successfully after doing your program. So
Mhm.
I think it's such a beautiful thing to think about dance as a way into that, as a way back home to yourself, to your
Mhm.
body. And sometimes we have really challenging relationships with our bodies,
Mhm.
whether it's society or our family, or just maybe the fertility journey in and of itself has been challenging. So I think
Mhm.
dance therapy is a way to kind of come home to you.
That's beautiful. Yeah, I can, and it could be, generational, or religious, or other kinds of confinement that we don't even realize, were part of our makeup from the time we were very young. Because when I sometimes will think like, okay, so a toddler will dance, they'll move, they'll run, they'll play, they'll skip, but then maybe not all of them, because who knows what the restrictions and constrictions might have been. So the idea to be able to still yet open up to living fully and fully expressive in your body just sounds like such a key to freedom.
Yeah. And I think we think about like what happens when you tell that toddler, "Oh, stop doing that."
Mhm.
"Oh, you're being too big. You're doing too much." And somewhere we got the message that being expressive and joyful and playful in our bodies
Mhm.
is not allowed. And
Mhm.
I like to, rewire
Beautiful.
that.
Well, thank you for the work you do. Listeners, viewers, please reach out to Lisa. As this resonates with you, check out her website, schedule a call. And if you are listening and you are part of a corporate wellness or a university or something like that, you heard her say she likes to do classes as well and she can go on site. So consider reaching out to her and then getting literally more bang for your buck by having a group together. And I can only imagine that also, I'm thinking in the corporate setting, creates such a bond among the participants. They're doing this thing together. And so that could really increase, kind of cooperation and productivity aside from whatever each individual's pain point is.
It's really interesting. When I worked in patient psych, one of my supervisors commented that we always had like kind of a kinesthetic thing with the patients. It'd be like we'd be on the same level, or like, the art therapist and the music therapist still had a little bit of reserve, but us dance therapists, we like had this thing where we just connected. And there is something to be said about moving together. It does build a connection in a way that I don't think words alone can do.
Oh, without a doubt. Without a doubt. Yes, I think that we're literally moving the energy fields. The
Mhm.
chi is again my language, so that we really do experience like in our bodies and in our spirits that we are one, and
Yeah.
that we really do have a relationship with each other that can be supportive and uplifting.
Yeah, and we can borrow from each other, right?
Yeah. Yeah. And,
I
and
love that interaction and that. that exchange of energy that can
Hmm.
happen.
Hmm. Lovely. Well, Lisa, thank you so very much for your time. I hope that I get to have you back at another time to delve into this more. Maybe we'll do one for the pregnant lady or the perimenopausal lady or the
Absolutely.
person, the person. I'm speaking with a therapist. I have to remember my gender correctness here. So anyway, it's been really a delight to get to know you even better and to hear how dance therapy can help everybody, but in particular, how it can help the person struggling with fertility. So I really am so grateful for your time. And viewers, again, check out the show notes so that you can get through to Lisa whenever you're ready. And until we connect next time, I'll just say class dismissed at Health University. Hey, thanks for joining us today here at Health University. If you want more episodes like this at Health University, you can find them wherever you get your podcasts. And make sure you subscribe to our YouTube channel so that you never miss an episode. If you have any thoughts or questions, please drop a comment down below. We'd love to hear from you. Thanks for watching, and we'll catch you at our next episode of Health University. But for now, class dismissed.